In India, COVID-19 deaths hit another global record. The country reporting more than 4,000 deaths Saturday alone, bringing the death count to nearly 240,000 since the pandemic began. Hospital beds, oxygen, medical workers in short supply as cases continue to surge. About half of the states have declared total lockdowns, trying to curb the spread of the virus. And joining me live is Dr. Abhinav Singh, a friend of the show. We usually have him coming on to talk about how much we need sleep. He is an internist and a sleep physician here in Indianapolis. He is also a board member of the India Association of Indianapolis. He's joining us now to give us an update on the situation there. Doctor, we so think about you often. We know that you recently lost an uncle. Your mom and dad are there. Can you tell us a little bit about just how you're feeling right now and what is the latest?
It's difficult. Good to be here on the show, Angela. Last week in New Delhi, my uncle fell ill, could not find a hospital bed which had oxygen support. And unfortunately, we lost him. And this is a story that's heartbreaking, and it's repeating as we speak right now in India in thousands of families. It's a very virulent strain, over 4,000 deaths a day, over 350,000 cases a day for the last 2+ weeks, and an upward spiral. It's difficult.
What has the India Association of Indianapolis done so far to help? We had one of your friends, another doctor, on last week telling us a little bit about it. Can you update us on that?
Yes, so my good friend Ajay was here on the show, and thanks to that we got attention to the matter, and a lot of generous Hoosiers came forward and helped and donated. So we've done sort of a few things since the pandemic began. We've had webcasts and status updates for the community and anybody who wanted to join our educational webcasts around COVID. We also have been running a free medical clinic since last year for families stuck due to pandemic-related travel restrictions. Most recently, we've been trying to raise some funds and partner with certain organizations, as well as individually us send supplies to India, concentrators. We were able to raise, funds and send about, half a dozen last weekend, but we need to do much more and partner with several organizations and keep doing so.
I want to talk about your mom. She's in India. Mommy and Dad, we have about a minute left. And I know on Mother's Day, she was cooking for those who need help. Can you just tell us a little bit about your mom? And again, this is obviously personal because it's your home country. You're a doctor. You want to help as many people as you can, but also just having your mom there and how much you worry about her.
Yes, they are in a little town in the center of the country. And I said, Mom, what are you doing in the kitchen on Mother's Day? She said, I'm cooking meals to help out the people in the building who've had someone who's ill or who's away. So she was sending meals, and that it just touched me. And I said, I love you more, and please keep helping.
I want can you leave us with kind of that message we talked about in that we did a little bit of a pre-interview. It's really a phrase that you want all of us to know, and it's really about us all being kind of one together and helping one another.
It's a classical Indian teaching. All Indians know this, and it's called Vasudhaiv Kutumbakam. It basically translates to the world is one family. So therefore, if we are going to suffer, if we are going to heal, if we are going to overcome, we have to do it together because the world is one family. And never before has this been so true.
Dr. Singh, we appreciate your time. We're going to put up the information on our website again where people can donate money or if they have, anything that they can give when it comes to those oxygen concentrators. We'll try to help you out even more. Thank you so much.
Thank you so much, Angela.
You're welcome.